Maternal fetal medicine specialist is an obstetrician gynecologist who specializes in high-risk obstetrics. We take care of pregnant women from the time they decide to become pregnant. If they have any medical complications they want to optimize prior to the pregnancy. We take care of patients during pregnancy, especially if they have any medical or surgical complications. And then we'll take care of any problems that arise during delivery or immediately after delivery. A maternal fetal medicine specialist is an obstetrician gynecologist who then does an extra 3 years of training to learn the high-risk medical and surgical complications of pregnancy. A general OB-GYN takes care of routine pregnancies. They take care of the pregnancy itself, and then they take care of the delivery. When an issue arises during pregnancy, whether it be immediately prior to becoming pregnant, whether it happens during the pregnancy itself, or if some problem arises during the delivery, a maternal fetal medicine specialist is usually consulted. We're also consulted when the pregnancy, the baby, has an anomaly that's detected or a problem that's detected. We get called in at that stage also to help manage the care of the pregnancy and the care of the delivery of that pregnancy. It depends on the healthcare system. Normally, an obstetrician will refer a patient in to see a maternal fetal medicine specialist when an issue arises during the pregnancy. However, occasionally a patient will self-refer in, particularly if they've been followed by a maternal fetal medicine specialist in a prior pregnancy. A maternal fetal medicine specialist, a perinatologist, a high-risk obstetrician are all one and the same. All high-risk obstetricians are board certified in maternal fetal medicine. A maternal fetal medicine specialist treats a wide gamut of pregnancies. We start with any fetal complications that arise, such as when we're doing an ultrasound and we find a cardiac anomaly. A maternal fetal medicine specialist is involved in the care of the continuing pregnancy and also planning for delivery. We also take care of a mother, whether she had medical issues prior to pregnancy, such as diabetes or hypertension, or medical problems that may arise during the pregnancy. A maternal fetal medicine specialist is often consulted. Finally, we take care of problems that arise at delivery, whether it be a problem with bleeding at delivery or a complicated cesarean delivery. A maternal fetal medicine specialist is consulted. A maternal fetal medicine specialist is consulted at any time that an issue arises during pregnancy. We see patients prior to them becoming pregnant so we can optimize their medical care. We'll see a patient anytime during the pregnancy that the general obstetrician is concerned, or we'll see them only at the time of delivery, just depending on the issue. A maternal fetal medicine specialist performs a wide variety of tests and procedures. The majority of maternal fetal medicine doctors do prenatal diagnosis and ultrasound, starting from basic ultrasound on up to very high-level targeted ultrasounds and fetal echocardiography. We also do prenatal diagnosis, where we do different tests and procedures to help determine if there's any anomalies in the baby that we can detect. It depends on the situation. Most of the time, a maternal fetal medicine specialist will consult, will develop a plan of care with the patient and her obstetrician, and then the patient will return to their obstetrician for their antenatal care and for their delivery. Occasionally, a maternal fetal medicine specialist will be asked to take over the care of a patient or assume the care of a patient at the request of the obstetrician if the situation arises that they need a higher level of continuous care.